Welcome to Doctor versus
Patient. And on today's episode, we will be covering the pelvic floor. What is it? What does it do?
All phenomenal questions. For those of you that don't know, I'm a doctor of physical therapy, trained in orthopedics and women's health. And so today, Emily has some phenomenal questions, and not just general ones, but some of the odd ones, some of the edges that we need to cover these topics because they're important. I think every woman should know.
Yeah, I think today's episode is we're going to keep it light on the pelvic floor. We will go into more of the anatomy of the pelvic floor and what you can do, specific exercises for that another day. Today we're just going to do an intro to it and let's learn a little bit about the pelvic floor. And then at the end we are going to ask some of the silly questions that people ask me and you about pelvic floors, and I always find it hilarious. So that's what we're going to end off with. And I think it'll be a great episode into the pelvic floor. So, Sarah, how do you feel today?
Today?
Yeah, how do you feel?
Ready.
We feel ready? We feel ready?
Excited.
Okay. All right. So what is the pelvic floor?
Great question. So we have to know our bodies, right? I think a lot of people talk about headaches, backaches, foot pain. Not many people will say, oh, I know what the pelvic floor is and I know what it does. It's another muscle group, guys. So if we take it back to a machine, the piston of a car or the piston of an engine is the tube, the funnel, the top and the bottom. Let's keep it very simple. And so the bottom is used to hold, right, the base. And then we have the top, lid, and the surrounding on the outside. That anatomy exists in us innately. So we have the top, the diaphragm, the abs in the front, the obliques, the back muscles, and then all of the internal organs that make up that canister. And then the pelvic floor is the bottom. And so we have to have it for multiple reasons. And there's 4 different jobs that it does. Keep it very simple. Stability, sphincteric, which we'll get into later. And then the sex aspect. Guys, we'll dive into the 4 different aspects of the pelvic floor here in a bit. And we'll add in a little PDF file just so we can dive into the academics. But all of that being said, it holds our bones together. It supports our internal organs. And it lets us go to the restroom. And then the 4th one is sex. So all of these are functions that are normal. So if we have any issues in any of these 4 categories, it might be a problem.
Okay. All right, so we're going to dive into a little bit of that. So one of the issues I think a lot of people struggle with is incontinence. What is incontinence?
Right. So continence is the ability to hold your urine when you don't need to go. Number 1 and number 2 is what we often call it, right?
Yeah.
In childhood anatomy and understanding how our bodies work. Number 1 and number 2, go when you need to go, and don't when you don't need to go, right?
Or you don't want to, or can't.
Yes.
Right, because in today's society, we can't use the bathroom as much as we want to.
Gas station.
Yeah.
Hold it.
Yeah. So is continuously urinating on yourself normal?
No.
Incontinence is not normal.
No. So incontinence is abnormal. It's not a normal function of the pelvic floor because you should have control, ideally. Right. And if that is not present, I think we joke about it a lot, female to female, especially in sports like CrossFit, weightlifting, basketball, and it's actually not normal. So we need to stop normalizing that. It is not okay, and it's indicating that something might be off. It could be back, hips, abs, different things.
Yeah, I think it's seen a lot of the times as super normal after giving birth. I don't myself have children, but I am in that age group where a lot of my friends do have children, and they experience incontinence after giving birth for quite a while after, and that always concerns me a little bit, and I'm like, maybe you should see your doctor about that. So it is not normal to continuously urinate on yourself. And I would definitely probably bring that up with your doctor, right? I would. I'm sure that she agrees as well.
And I hope that conversation becomes normalized in our care and postpartum care. And hopefully women will understand that that's something to watch out for, a yellow or red flag, depending on how bad it is, that they can keep an eye out for it in the future. And then also educate their children as well.
Yeah, I think we've all laughed as girls, giggled until we peed, okay? That's not really what I'm talking about. I'm talking about every time you sneeze, cough, laugh, every single time. Not you laugh so hard for 20 minutes and couldn't stop giggling because you had too much wine with your friends, and that happens. That's fairly normal, like a little bit. But if you're like urinating, like, I'll just be honest. I, at a point in my life before I met her, was peeing my pants in traffic all the time. Like, I drove an hour and a half to work in the morning from where I live into downtown Dallas. It's like an hour and a half drive. And I was peeing my pants in the car every single day. Like, my seats are ruined from constantly doing that. And it was bad. And I just carried extra pants with me everywhere I went.
I think a lot.
I had a towel under me, or I had like an emergency cup in the car, which is so disgusting. But I had to have an emergency cup in the car to pee in because I had to stop peeing on my pants. So I was like, I would just hold a cup there when I was driving.
Oh my gosh.
And I couldn't control it.
Yeah.
And that sounds like, oh, why do you, like, I literally could not control it.
Yeah. I would say it's common but not normal, and that's definitely at the top tier level of concern on my part. When I hear that, that's a concern.
Yeah. So
and you don't have to live with it.
No, you don't have to be embarrassed about it. It's super common, super normal. Or not super, it's super common, but it's not normal. It's not a normal function. It's an abnormal function of your bladder, right? So something is most likely going on. So we're going to get into some stuff that maybe children shouldn't watch, just so y'all know. So maybe don't have your children watch this. Is pain with sex or orgasming normal?
An orgasm is a normal function of the pelvic floor. And what was the other?
Is pain with orgasming normal? Pain with sex or orgasming, because they're two different things. Because some people experience pain just with sex to where they cannot orgasm, and some people can still orgasm but with great pain.
I would say anytime there is pain or discomfort for the majority of the time, and every case, there's a variety of patient cases that might be different, but for the most part, pain in the pelvic floor, especially with intercourse and with an orgasm, is not okay. And depending on the type of pain, the body usually will indicate what aspect of the body is malfunctioning or trying to say, help me, right? So burning might be the capillaries or the arterial blood flow, the arteries and the veins. The stinging and electricity, that could be the nerves as well.
Like the
shooting, stabbing.
Yeah.
And then pinching, throbbing can be, and tightness, that can be more of a muscle pain. And sometimes, usually, if we're being honest, it's a combination of different things. And so there's a lot of different things that I'll work with patients on, and this is common for pelvic floor physical therapists, hopefully, to have this discussion, but we have to dig into what positions women are in, what exercises are they doing, because I don't know that a lot of women think about sex and physical intimacy and intercourse as a workout. And that's how I actually educate a lot of my patients that, well, when's the last time that you held that position? When's the last time that you used your abs or your legs? Did you do mobility? Did you have stability? Do you have that strength? And so I think because of the brain, we forget about that, right? In the moment, our heart rate might be elevated, and if the mind is elsewhere, we might not actually pay attention to our body as much, or we might feel it after the fact. And so I think it's just wonderful for women to get curious about, every woman's different, and so if they have a preference or a certain style, I think that's a conversation with the partner, and to be honest, right? There might be an endurance limitation, mobility, and so we can get into it as if it were an exercise.
Yeah. I also think some people have been experiencing pelvic pain for so long or pain with sex, and they almost disassociate. I know I did. And I had to check in with myself, really, and be like, is this actually super painful for me? And how can I help myself in this situation? Like, can I convince the man to put me in a different position or try something different? And hopefully you have good partners, though. I really suggest getting a good partner before anything else. My gosh.
That's aware and is able to care about your needs in that moment. I would say, for the audience, I don't know that we covered this yet. Can you explain more on the disassociation component? Because that is exactly what we, as physical therapists in the pelvic floor world, we will try to navigate gently and educate the woman, because a lot of times they don't even know what that is. And so I think that's a phenomenal topic. Yeah,
so if you feel almost like you're leaving your body a little bit, looking at yourself from outside of yourself, and not in an enjoyable way, or you are kind of counting down the minutes in your head of when this is going to be over, and you're kind of just staring off into space and you're not really present with the partner, I would say that kind of counts as disassociating. Or you're trying to separate what's happening there from what's happening here. Because it doesn't mean that sex isn't enjoyable in your heart. If you love the person, you're trying to connect with the person. I've had this conversation with partners before that I still enjoy. intercourse, even though I am experiencing pain. And if I'm experiencing, like I did recently, I dislocated my hip. It's a whole thing. I'm gonna most likely have to have surgery for it. But that flare-ups, things like that, can always cause more pain again. Now, on a daily basis, do I experience as much pelvic pain as I used to before her? No. And that is not normal, though. I'm not a normal case. Most people will. I don't want to, like, scare y'all, but this is going to be forever. It shouldn't. It absolutely should not be forever. You should be able to get with your doctor and a physical therapist that will help you. Unfortunately, I have rare diseases that kind of comorbidities that come into play. So should you tell someone that you were experiencing pain with sex? And who should you tell?
Absolutely. I think first and foremost, we just need to be honest with ourselves. Like you said, check in with our bodies, and that don't as much as you can. I would encourage women to not. And this is what I've heard from a lot of my cases that I've seen as well. That they feel obligated to, like, it's a performance, and so that they must act a certain way, or else they will be seen as a failure, not feminine enough, not a woman, that they will be less than worthy of that partnership. And so I just want to encourage all women that this hopefully will be a conversation. But in terms of who should they talk to, be honest with yourself, be honest with your partner, and then also bring that up, please, with your OBGYNs. And that should hopefully happen before an internal exam. I think a lot of women don't say, I just wanted to let you know, if they do need to do some type of internal exam that day on the yearly checkup, or if there's another follow-up, that please let your doctors know, because there are options for internal exams and the tools that they use. And we talked about that earlier.
Yeah, so for me, they have to use, like, it's almost like the pediatrics speculum. And we can get into why they have to use that on me. I think that'll come up in another question. So there are options of what they can do, and they don't have to tighten it as much. I feel like sometimes doctors will just go in there, just go in there and crank it right up and be really aggressive with it, because they think that it can handle it, right? It's like, oh yeah, it can stretch to this big and have a baby. It can just stretch right now. It's like, well, not necessarily. You haven't warmed me up in any way, and I'm not really dilating right now or anything. My body's not really in the place to want to stretch that far. So I think it's a conversation that you might want to have before they're going in there. Because I really didn't tell anyone until they could tell that when they were putting speculum in the eye that it was a problem.
Mm-hmm. And there's a difference between apprehension about a test versus pain. And I really encourage women to have that conversation with, even a pelvic floor. It doesn't have to be necessarily a pelvic floor specialist, PT, but hopefully if you can have a discussion with your chiropractor or your massage therapist or your physical therapist about who you can get in contact, hopefully in your area, that would be phenomenal, because someone needs to know, because that's not a normal function of the pelvic floor. So hopefully we can go ahead and knock that out.
Okay. So is continuing to have sex while you have pelvic pain bad for you?
I would say it depends. Like anything, like any other muscle in the muscle group in the body, however, the pelvic floor having 4 different jobs of the stability, support, sphincteric, and sex. If there is pain, we have to slow down and be aware and say what type and what's the duration and the frequency. And a lot of times there are ways where you and your partner can actually work through certain levels of pain. Generally for my patients, and this is just how I practice, I'll say, all right, and this is on pretty much any exercise as well. For most cases, I will say, if there is a pain that is above a 6 out of 10. Now that's relative for every person, right? For those people with high pain tolerance. If there is a pain that's over a 6 out of 10, there's a few things we can do. Breath work, slowly back off, because pain can be both on initial penetration and initial stretch, and also a potential removal. And so there's a lot that we can work with there. So just during intercourse, the stretching and the pressure of the muscle, and having that contact, and we call it in physical therapy grade 0, 1, 2, 3, 4, 5. And so how much of a stretch do we have? Kind of like an elevator. So if the pain slowly calms down with breath work, with sustained pressure, with a different angle, that's okay. And most of the patients that I've seen in the past, they'll be able to work through at a comfort level that is easy for them to navigate. And so oftentimes sex can become actually therapeutic in terms of a deep, it's almost like a soft tissue massage or a pin and stretch. There's a lot of muscle energy techniques. These are all different styles of treatment for these muscles, that how else are you going to
work out,
to work those? And so there should be optimal blood flow, just like any other muscle in the body. Deep pressure, stretching, sustained holds, it increases blood flow in the area. And so this is assuming, obviously, that a lot of comorbidities and or surgeries have not happened too. So there's always a variety, but in general, I would say that if there's pain, don't run from it, right? Because then you tell your nervous system, pain happens every single time I go here. Then what does the body think? This is a threat, right? And so then will your body relax the next time it goes into that same space? Probably not. So we want to make sure that the body feels safe, and that's where you have to be aware and communicate with your partner.
Yeah. Hopefully good communication is happening. If it's not, I would say run. To be really honest, it's not worth it. I have been with
Sprint.
Yeah, sprint as fast as you can. Run like a girl, and I mean that in a complimentary run. Run like a girl. I've been in relationships like that where they don't understand, and that's just going to make it worse, and it makes it harder for you to then retrain your nervous system. That sex is supposed to be good, it's supposed to be pleasurable. Also, but you didn't touch on lubrication.
Yes.
Make sure you're hydrated. Just like for any workout, make sure you're really hydrating, because then everything there will be fluffy and nice and not so dehydrated. And lubrication is a huge thing, especially for older ladies.
Yes, and on that topic, I'm really glad you mentioned that, because estrogen dominance and hormones have a huge play on the lubrication of the pelvic floor. And a lot of women in the menopausal transition will have decreased estrogen, and so it's an easy not over the counter, but it's an easy call to your OBGYN where they can call in a topical estrogen cream with different types and intensities, just like medicine, but it's just a cream that is put on, and what it helps is the quality of the pelvic floor muscles to make sure that they are strong, right? And bulky, just like a bulky bicep muscle is healthy, right? Especially we need that strength when we're getting older.
I call it fluffy.
Yes, it should be fluffy, but not stringy and tight.
So you say fluffy, because as you age, you're not as fluffy.
Right. We need that.
You're not as lubricated, unfortunately.
Yes. So it's easy fix.
Yeah, easy fix. Is never orgasming normal?
That is
like
not,
almost never having an orgasm.
That is not ideal. However, it depends on, like, if there's a spinal cord injury, things like that. In other scenarios where the anatomy is actually different, the neurochemical changes, all of that. But women should experience
Say
orgasm.
I've never had a spinal cord injury, never had, like, any nerve pinching from herniated disc or whatever, and I just never orgasm. Like, if I have full sensation, but I don't have an orgasm.
In the optimal scenario, that will be a problem. I would have questions, right? I would have a concern. Okay. Not necessarily that you are broken, but I, as a physical therapist, I would have questions in the pelvic floor realm of what's going on, and we'd dive into the story there.
Yeah. Are there cross wires, are there wires getting crossed? Is something happening? And
it could be other things as well that aren't in my specialty of neuromusculoskeletal. And I think, again, that's a conversation.
But it's always good to rule it out.
Absolutely.
Because your physical therapy is kind of like the light work. Like, before you... And insurance always wants you to see them before you get any surgical options anyways.
Outcomes are better.
Yeah. It's more... They're more for managing, right?
Optimizing health.
Yeah. So how often should we be getting an internal exam? Like, is it every time that I go to physical therapy that I have to get an internal exam? Like, do I have to prepare for that?
Good question. I think that's the number one most frequently asked question when any woman, at least in DFW area when I was managing, that they would ask prior to coming. And that was actually a barrier to entry, that they were concerned. They said, hey, look, my doctor's sending me and I don't want to do an internal exam, so I'm not going to come to pelvic floor physical therapy. I don't need this. And what I think if they had been told or understood, you always have the option you always have, it is your body. You always have the option of whether or not you want an internal exam. You can deny that, defer that, and I think it's the physical therapist's job to say, this is what I recommend, this is why, and this is what I'm missing if I don't have this information. And then you can work around their preferences and say, I'm hitting a wall, or I can't further diagnose based on X, Y, and Z. I think it's a conversation. And so I think that puts puts a lot more comfort into the patient's heart, that they don't get anxious or worried. And because most people don't know what to expect, but hopefully that becomes more common. And an internal exam does give me a lot of information that I don't get just on an external exam.
Yeah, but you don't have to do it every single time though.
Absolutely not.
I feel like some people think that what pelvic floor physical therapy is they're just in there like touching in you all the time, and that's not what it is at all. It's typically like you'll have checkups every once in a while. When I did it, I wasn't aware that there was an option to deny the internal exam the first time. This was before I saw you. I wasn't aware that I didn't have to consent to a rectal. They just kind of like, okay, we're going to do this now, so take off your pants. I was like, oh, okay. And my friend was with me, and I was, oh, okay. And it was something that I had already, 2 weeks prior, had been in the doctor before.
Right.
Because they had found it, and then they told me to go to this person, and I went, and I had my friend there holding my hand, because it hurt really bad. It hurt really bad. And I didn't know until I came to you that you don't have to do it the first time. You can get to know the person before they go inside of you. That's an option. That's an option that I didn't know, I wasn't aware of.
I think that's important, like you said, the comfort, right? You get to know that practitioner, because this is very personal. A lot of people, even when they do get into the pelvic floor realm, it has been a long time. Hopefully, again, we make this more mainstream and normalized, just like if someone said they never saw an OBGYN or they never saw any doctor, you would kind of look at them sideways a little bit, but hopefully that doesn't happen in the future, that there's more comfort and control for the patient, and conversation.
And as they're doing the internal exam, I feel like some people, because it is awkward and uncomfortable, I know myself, I just kind of like, okay, it's going to happen. And I just kind of let it happen. Should you be telling them where and how it hurts while they're doing it?
I would say
Would that be helpful?
Absolutely, because that, again, we don't want the nervous system to be traumatized or sense a fear, and then have that cycle through every time. But the conversation of pain, even with your therapist or your pelvic floor therapist, should be happening. And then they can tell you, okay, well, what are you feeling? Is it less? Is it more? And that's no different than when we do any other type of treatment as well. Like, this is what I want you to expect. Are you okay with that? And go from there. It's all based on your tolerance, for sure.
Okay, cool. Okay. So as a pelvic floor physical therapist, I'm sure you guys have questions too, of kind of what little causes could come about, like why it happens. One question that I had was, what sports do we play as young girls that you see the most that cause pelvic floor injuries? Like, what are the most common sports played that cause injuries to this, that kind of go overlooked?
I would say the most severe that I've seen have been gymnastics, dance, and swimming, just because of the compression, the plyometrics, and a lot of the adductor, the inner thigh activation that's required for these sports. And I would love for you to touch on that, because I did more basketball, track and field.
Yeah.
And so I did gymnastics for a very short time as a child. And after that, I wish I would have done dance, but I didn't get to do those sports because of the overlap.
Yeah. So I was doing competition dance and gymnastics at the same time when I was a kid. I didn't continue to do gymnastics when I was in probably 8th grade to high school. I stopped because I just wanted to focus on choir and soccer. I just had too many activities, and I did do softball. I literally played every sport in the whole entire world. But I always wondered if a lot of that came from gymnastics. Like, obviously having Ehlers-Danlos syndrome is kind of the cause of a lot of my pain. But I wondered if some of the things that we did in gymnastics, if that kind of caused it. Like, I have memories, and I know that if anyone is watching this that has done gymnastics or dance, that some of your coaches may have done this to you, but I had coaches that kind of like slammed my legs down in the butterfly, and I always wonder, because the extreme groin and like adductor and hamstring pain that came from that was pretty intense, and I always wonder if that was kind of a cause of it. Also, the constant when you're doing gymnastics and when you're doing ballet, right, or you're doing any type of dance, competition dance, like it's all about lines, right? You want your lines here. And it's always a deduction. Everything has to be very tight, and everything's right here in your core. This is how you hold up your whole entire body. It's not everybody holds up their whole entire body, but definitely whenever you're doing gymnastics for balance, it's all here, and everything else with your arms is supposed to kind of just be for show almost, for barely balancing. But it's all about clean lines, especially with your legs, right? So you get deductions if you land with one leg out, right? You have a strong leg and you land on that one, and your weak leg is out front. That's a deduction. I don't think people really realize it when they watch gymnastics, that is a deduction. And people are like, oh, that was a perfect score. No, not really. Not really, because you got to land like this. It's a lot. It's a lot on your lower spine especially. And I always wondered if that was kind of a part of it. I also heard that people have issues with horseback riding as well. If you've been if you've been equestrian like your whole life, I always wondered if that.
And strongman, powerlifting, oftentimes, and in CrossFit, as more of a older woman population, or as women age into like 20s, 30s. I'm not sure about how frequent or how prevalent the incontinence, or urinary incontinence, is with CrossFit powerlifting at a younger age, and that would be something, I'm sure we've done the research on that to get an accurate number. But all of those is an overload of the pelvic floor, either tightness, an inability to coordinate with the breath work, with the ab work, or misalignment, and there's a lot of little things that can make the pelvic floor just completely.
Yeah, your diaphragm is huge. Your diaphragm is huge, and I feel like everybody tells you to breathe a certain way whenever you're doing certain exercises. But nobody's telling you that it's because you could harm your pelvic floor. Like, nobody tells you that. There's like, keep your breath work. And I feel like that's one thing they never really touch on in training or anything. No one ever addresses the pelvic floor. It's very strange. That's why we want to do this, is because no one ever touches on it. Like, I feel like even when I hear male trainers, or just men in general, they're always talking about, like, their back hurts, their groin hurts, their hips hurt, but they don't ever say, like, hey, my pelvic floor hurts.
And pelvic floor for men can get...
It can get really bad.
Differently, and yeah, that's a whole nother.
And it can get bad, and I feel like they don't talk about it. I know that we're more women based, but I do question, because I feel like I seem to only attract athletes, and I date a lot of athletes, and I feel like they have like pelvic pain that they're not addressing.
Which hopefully that changes.
They're like, this hurts right here, and I'm like, yeah, do you feel it like on your pubis anywhere, or like? And they get really, really uncomfortable.
And I was gonna touch on one thing that you mentioned. The leaking of the pelvic floor with lifting. That, in my book, I would look at that as a failure of the pelvic floor, or the abs, or something, the hips,
the heavy lifting.
Really, in general, like really heavy lifting for sure. But even coughing, sneezing, laughing, jumping, running, right? Those types of things. That's a failure of some aspect of the pelvic floor that needs to be coordinated, and so ideally you just want to monitor it. And there's times we can't be perfect all the time, right? But I just would encourage women to look at it and be aware. I consider it, especially with myself, if that happens, I consider that a failed rep. So if I'm doing a deadlift and that happens, even if I make the lift and it's perfect and I don't have back pain and I don't have foot pain and everything was fine, I failed somewhere because I lost the ability to hold my urine, right? So. Yeah,
I have seen that with women power lifters, and they almost view it as a rite of passage. Like, they really push heavy, and I was always like, that seems kind of odd.
I would love to work with the power lifters and strong men, strong women, to see. I have a lot of ideas of how we can, one, hopefully stop normalizing it, and be more curious about how we can decrease that frequency.
Yeah, because I've seen that. I've seen that with female powerlifters, and I always wondered, like, is that just because you're straining so hard? But then I'm like, but is that good to strain that hard? I don't know. Yeah, I have questions about that. So, what are common co-diagnoses that come with, like, pelvic floor dysfunctions? What do you see that are coupled together? Because I think that's always interesting, because people will have multiple things.
Absolutely. Low back pain. It's huge.
Yeah, that makes sense. Well, it's directly connected.
Hip pain. Sometimes knee pain. I think the two most interesting ones that you and I chatted about earlier offset was TMJD, so temporal mandibular joint dysfunction, and that one gets really deep, and foot pain, so plantar fasciitis is a general one, right? Those two, because of the fascia lines, which is that rubber band system inside the body, it's a beautiful system. It stores and releases energy and interacts with the joints and the muscles, and it's a highway system. It's a phenomenal organ within the body of connective tissue, and they call it the sling system. So that one goes all the way from the jaw all the way down to the feet, and guess where it crosses? Midline, right? And then the pelvic floor, being the base of the piston, often shows up with some type of dysfunction. So oftentimes I'll check for frequent or common symptoms, and it might be a puzzle piece, but it might not be the driver, right? So that's our job to figure out. But low back pain, hip pain, the pelvic floor is involved in everything. And I would definitely look out, especially for women. It's very common with jaw dysfunction and foot pain.
Very interesting, because I also have plantar fasciitis and I have TMJD. I also have problems with my TMJ, and I didn't know that those two things were so closely related until she kind of explained it to me. I was like, well, that makes sense, because I learned in anatomy that when we're in utero, that we kind of branch off like this. Our nervous system branches off like this, right, to make our two limbs up here, right, like our arms and then our legs. And so what's really interesting, I feel like one day whenever we get really deep into pelvic floor, we got to show these photos of what the inside of your throat looks like versus your pelvic floor and how similar they look. And it's because they were at one point the same cells.
Yes.
And that makes sense why these lips look like those lips. And I'm gonna leave it there. Can your pelvic floor be too strong? I feel like everyone talks about weak and prolapsing. Can your pelvic floor be too strong?
And I have heard that before. So I would say define strong, right? We have to define strong. And I think a lot of women will consider themselves and their pelvic floor to be strong. But what I often see when women come in and I would ask, do you think your pelvic floor is strong, or what's your view? I know, right?
I had a leg itch. I'm sorry. Did you have one too?
My foot's going nuts.
Oh, okay. Cool. Got it.
That I think a lot of women some will say, oh yeah, my pelvic floor I'm strong. I don't really have that much of a problem. I just need X, Y, or Z. And then when we actually do the exam, there is what we call hypertonicity, where the muscle is too tight. And so my mentors have explained it to me, and I use this analogy all the time. So if I have a bicep that is too tight and hypertonic, it's going to be like this. If I have one that is hypotonic, tonicity is the tone, hypo, it's going to be a little loose. And coordinated, that all looks different. And so the example that I give, and this is for other muscles in the body as well, but with pelvic floor, I say, guys, this is, if I came to shake your hand at the very start of the session in the lobby, say, hi, my name is, and I did it like this, what would you say? You would say, oh, something's wrong, right? Oh, she needs to stretch out her bicep. You wouldn't say, oh my gosh, she has a very strong bicep.
So strong.
That strong is different, right? Strong is different.
If you're constantly flexing, right?
And then if I had to grab my arm and shake your arm, hi, Emily, my name is, right? That's hypo. You would say, oh, there's something wrong with that. And then if I went to shake and that happened, right? This jump of my hand.
Yeah.
Somebody would say, they would consider that abnormal, right?
Yeah.
All of those are present. And that's part of what we're looking at too, is the quality of the movement, the quality of the tone of the muscles and the fascia and the ligaments, and the nerves. Like, do you feel this? And what is the temperature? Well, there's so many different things that we're looking at. And so I would just caution women to assume that you are strong, because you might actually have a hypertonic pelvic floor, that the quality of the tissue is really hard, and ideally we want it to be soft like butter that's been sitting out on the counter for a few hours, at least getting soft for Thanksgiving dinner, right?
Yeah.
So that quality is, it feels different, and that's what we're trained to identify, whether it's hypotonic, if it's flaccid, if there's a potential nerve injury or impingement. All of that's part of our assessment.
Yeah, I feel like everybody always talks about Kegels. Kegels. Well, have any of y'all tried relaxing your pelvic floor?
What does that feel like, Emily?
I don't know. I try. I don't succeed. We've tested it. The only time it happens is if I laugh really deep, like a belly laugh, it'll push out. So some people don't need to do Kegels. I'm one of those. And there are lots of y'all out there that don't actually need to do Kegels. Please don't. Just assume that you need to do Kegels just because some lady on Instagram told you that doing Kegels is the best. Because some people have hypertenacity and they're constantly in the upward motion, and that can actually still cause incontinence. It's not just loose, right? Like pushing down. Your muscles are constantly wanting to push down. Sometimes when they're pushing up, that also causes you to pee a little bit. So that's why you should talk to somebody professional and not Instagram.
Oh, and on that, I'm like, yes, I could not agree more.
Yeah.
I would say the Kegel comment is
it's
one
so
of
annoying.
the ones
Kegel.
You will get an eye roll. You will get an eye roll from a pelvic floor physical therapist. Like, oh my gosh, I do my Kegels, right? It's a topic.
Do you do them properly? Do you actually properly let go?
Need to do it? And then, so I give the analogy of an elevator, right? What good is an elevator when it's always at the top floor?
Yeah.
Who's going to use that elevator? Oh, well, it can kind of come down to level 2, but really I stay at level 3.
Yeah.
What's the point of that?
That wire is so strong, it just holds it all day long right there. Such a strong wire, just holding it right there.
Not good. So we need a functional elevator, and that's hopefully where you get that, what we call proprioception. The awareness of the drop and the control of the drop. No one wants to be on an elevator that just drops to the ground floor, and then we shake a little bit, or it goes unevenly, right? Or it only goes up on the left side but not the right, right? All of these things are need to be looked at.
Yeah. This one is great because it kind of couples into what we just said. So can you have pelvic floor issues without prolapse? Absolutely. Mm-hmm. Yeah. Mm-hmm. You don't have to have prolapsing stuff to go to the doctor. I feel like that's the only time they go.
Mm-hmm. Absolutely.
And can you explain the different types of prolapse too?
So there's different aspects of the body that will present through the pelvic floor. So prolapse is a piece of your internal organs, and there's different sections of the body that we're looking at, and so there's different what we call grades. We're talking about elevator, right? There's an elevator like, hey, my pelvic floor is here, and then nothing else, everything else on the inside stays inside, right? Elevator going up. Well, sometimes things drop down and they stay down in places where they're not supposed to. That's essentially a prolapse. And we can get into the details of the anatomy later, but we're watching, okay, if it does come down, or when you're just relaxing and stuff is coming out, a lot of women will freak out. It's a very common discussion amongst pelvic floor physical therapists that we're not necessarily scared of it, because there's a lot of components that we need to check out and look at before we determine certain things. And oftentimes this is a conversation between us and the gynecologist, OBGYN, things like that. All that being said, there's different aspects of your body that might actually poke out, and that's our job to identify that, find that, and then grade it, and then watch it. And I have had some really interesting cases where one lady, she was in a car accident, and so the driver of her prolapse was actually coming from her low back. And once we took care of her low back, and she needed a little bit of extra work and some dry needling and things like that in E-stim, the combination of the awareness and other pelvic floor exercises and addressing the whole body, right? And the components that were involved in her case, we saw a lift, right? Yeah. And the one that she was able to maintain. So
sorry. I don't know why my ankle keeps itching. I think I'm losing blood flow is what's going on.
Do you need to take a break?
No, that's okay. They can see this. I just lose blood flow because my hip is jacked up. So I've just got to shush it out. And that's okay, guys. This is normal. Oh, there it goes. It's clicking. Okay. Anyways. Sorry, I'm so sorry I interrupted you.
No, that was it. I don't want women to.
So the cause of her prolapse was because of a back injury, not necessarily something wrong with her vaginal opening.
Right, and so that is our job as physical therapists and your clinical team to see what is the root cause of your problem, and sometimes it's a combination of things. So no stress, though. I wouldn't be necessarily scared of it, but it is something that I would encourage women to have a grounded foundational idea of what is the cause. And oftentimes that can be hypermobility, it can be a comorbidity.
A rough labor.
Yeah, exactly. Delivery. There's so many different aspects, but yeah.
And with labor and delivery, there's so many aspects as to why it could happen too. The position of the baby coming out, the position that the person puts your body in, the doctor puts you in. Cutting when they don't need to, like episiotomy. So there's lots of things. Can chiropractors help loosen your pelvic floor?
So loosen, we're going to talk about normalizing, right? The tone if someone's hypertonic or
I think I said that because that's what my issue.
Oh, gotcha.
So can chiropractors help with your pelvic floor?
Yes. So I always encourage people to know your chiropractor, have a discussion that we don't need to, and the ones that I work with, I trust completely because we have the same type of lens. Just like there can be good dentists, bad dentists,
good and bad
PTs,
ones.
bad PTs.
For sure.
There's a spectrum. So again, find one that you trust and that you feel comfortable with and you feel will listen to you. But just because something cracks doesn't necessarily mean that it needs to. And so, like we said, that there can be issues all the way up into your jaw. That being said, there's a lot of different aspects of the spine or the joints that will help optimize the function of the pelvic floor, and chiropractors are often highly specialized in that manipulation and hopefully even joint mobilization where they don't always have to crack you. So people who are already stretchy might need a different treatment than someone who is hypomobile, that 18-wheeler versus a Ferrari.
Cool. She's saying that if you're hypermobile that you're a Ferrari, which we talked about in the episode we filmed previously, but I don't know if it's going to come out before this one.
Surprise.
So that's what she's talking about. So I guess I'm a Ferrari. Mm-hmm. And then some of y'all are 18-wheelers. I'm so sorry.
Just different.
I'm just different. That's what she means. That is, I have a much more complex system. So I'm sure there's like some type of machine out there that would compare me to that is not a Ferrari, because I don't feel like a Ferrari, but that's okay. So if I'm having pelvic floor issues, should I just go buy a yoni egg? This lady on Instagram said I should buy a yoni egg. Should I buy a yoni egg? Should I put a crystal in there?
I would caution. I would go see your pelvic floor physical therapist or your OBGYN. Let's find out what the root cause is first, right? Before we start throwing things at it. Now there's some people who don't have access to pelvic floor physical therapists and OBGYNs, but at the end of the day, we need to ask the why, right? What is the purpose? What are we looking at? And be aware of your body and the changes, all of that. So I would just caution someone saying, I definitely need this. Not everybody does. And sometimes they can be detrimental to what your diagnosis is or how your pelvic floor is functioning.
Yeah. Mm-hmm. Yeah. I kind of had that question before the show. My friend sent me a video about this. She really, really believes in it. Should I do this? But I'm really scared because of my hypertenacity. Like, is it just going to get lost in there? And no, nothing can get lost in there.
It's not a cave.
It's not like it's not like an open cave system that goes to an aquifer. Like, it's like a sock, right? So nothing can go past the tip of the sock. But I had that question because I was just like, I don't know how I would get it out. I feel like that would hurt to try to effectively push it out.
Careful, yeah.
Yeah, so I don't think that everybody needs that. So I would caution doing that. I would not just believe it because Sarah on Facebook has an MLM and she's selling castor oil and yoni eggs. I don't think that you need to put crystals in your vaginal opening just because. Should I just do more yoga? If I'm having pelvic should I just do more yoga? Do I just need to be more flexible?
No. We need to go back to is flexibility. That would be us assuming that we're having a pelvic floor dysfunction because we're too tight. But a lot of the research and literature and even clinical practice is showing us that just because you are tight does not mean that you need to stretch. And the nervous system, if it senses all this range of motion and no safety and stability and no strength at this end range and the ability to control all of that, it's going to lock down. It's going to lock down because why would it put you in something that's not safe? It won't do that. So it will protect you in the only way it knows how, which is, I'm going to take it away. But you as in we in our bodies need to understand and be curious and aware of why that's happening to begin with. Okay.
Mm-hmm. Would you say that Pilates is a better kind of alternative because it's just kind of fit for everybody? I would say it's more fit for everybody than yoga.
I would say it depends on the instructors, right? And we go back to coaching. Like, it's good workout session. There's good and bad of everything. I love different styles of yoga and I love Pilates. Pilates, we usually have to have some type of equipment, but now there's a lot of online programs that are coming out where you can do Pilates at home, and I actually
with like just bands and the socks and
even just the wall. And I have a patient who is doing phenomenal on her home exercise program. She's just picking Pilates. And I'm asking her to target different aspects of her body based on what we found, and then adjusting as needed. And so she's doing really, really well. And so I would say it's patient to patient case. And then as long as we're instructed, or the woman is aware of what her target goal and sensation in her body, what she's looking for in those exercises, Pilates is great, yoga is great. We just don't want to hypermobilize and then lose stability at those end ranges. Pilates is great for that tone and tension, time under tension throughout all of these different ranges.
And his body weight. So you're not and then there's really putting yourself at too much of a risk, right?
Right, exactly. It's a lot more, and so for someone who is hypermobile, I would always decrease speed first, and then we can always earn back speed later. It's easy for you to go fast.
Very easy for me to go fast, but very easy for me to make mistakes and dislocate things. So that's fun. Should I get dilators and vibrators?
Again, I would say caution, it depends, right? So what is a dilator used for? Oftentimes for expansion and stretching and tone, being able, the tone of the pelvic floor being able to tolerate a certain stretch. And again, we have to look at, is the pelvic floor tightening because of something else? So if you're actively stretching, is it truly just that you need to get used to a stretch? Oftentimes I don't know that I've ever actually had a woman buy a dilator. They are expensive, the type that we use for PT treatments.
I have.
We have to make sure that there's different ones, right? But it's not often like the first time they come in and I'm like, you have to use this, right? Or else. It's more of like, all right, are we using this? Are we in a partnership? Are you by yourself? That kind of thing. And so we do want tolerance to stretch over time so the nervous system can get used to it. And if that's not in the budget, there's other ways we can get around it. Or if the woman doesn't have access to a dilator shipping through Amazon to her house, then there's other things that we could do. But these are all tools, and it depends, right? So dilators are great for low grade stretch to avoid pain and get the patient used to their own body's sensation of that stretch again, right? So those are great. What was the other one you mentioned?
Vibrators. Well, back to the dilators. Yeah. I don't feel like it's a one-stop shop. I feel like everybody thinks that it's the perfect solution, and I would say that you can do it wrong.
Mm-hmm. Absolutely.
Because I've done it wrong. I am one of those people that bought. I actually threw them away. I don't know why I did that, because they're really expensive. They are really expensive, and I probably could have sanitized them and given them to somebody else, but I was just like, it's kind of weird. I don't know. I don't think it's a cure-all. No. I don't think yoni eggs or dilators are going to be your cure-all, and I'm kind of tired of them being treated as such.
Right, and I think, like you said, it's not, if it's not addressing the root, right? If it's a massive component, or, I mean, there are cases in my mind where that would be highly recommended. I just often, it's not one of the first things that I jump to, because I want to understand their body's why, find the story. And then the vibrators, I would say one in general for anyone, 48 on the clock, an adductor massage. Adductors don't love deep overpressure, like really aggressive massage. The outside of the leg can take it, and I think that's because it's paired with our viscera and our internal organs, right? So the nervous system's very guarded around the inner thigh, and so for a lot of women, taking a light massage gun and working on those inner thighs is great. And then a vibrator itself, a lot of times, depending, again, there's so many different types, so be careful on the quality of the vibrator. These are tools, and vibration actually runs on a different track to the brain, and so the brain processes that as a calming sensation most of the time, and it increases blood flow, right, just like a massage gun. And so a lot of times this is taboo in, I would say generally, like in general with our population. I know, at least for my generation, hearing about those things and talking about those topics among peers or going to college, things like that, it was a little taboo. I don't know about your experience.
And to me, it's medicinal. Because the first time I ever got one, I was like, I don't really use that stuff, because I kind of just came from a background where that just wasn't really, like, I don't know, addressed. But the first time you recommended one is a pelvic wand. So it has a light vibration. It's not actually like probably some of the things you've seen. Oh my gosh, sorry. Rated R. It's not like a rabbit or anything. experienced a lot of success with that. With
Yes.
with kind of like, I don't know if desensitizing is kind of a good word for it.
It is, yeah, great.
Because I was too sensitive and tense and very angry. And it helped me a lot more than the dilators ever did.
Because that's actually...
And it's only that thick.
It's
only that thick.
It's not too much. And what I love about the pelvic wand, and I think that's why it's almost like that 5-in-1, right? There's multiple things that you can do. And I found that for my women, if I can... you guys being comfortable, patients being comfortable with a tool is paramount. If the patient is not comfortable with a certain tool or an exercise, the likelihood that they do it and feel the confidence to do it correctly probably is low. And so those, and we can put in the links too, but pelvic wands are incredible, especially there's ones for hot and cold, and that can be for surgery or there's a lot of different things, but there's ones that are regular and ones that have a vibration option, and then hot and cold. Now I will say that I don't actively utilize the vibration in clinic because I want that everybody knows or should know the sensation of a massager, and I just say this is no different. And a lot of times I want the female, I want her to be comfortable with her own body and utilize this and say, here's how I do it externally. Like we can show it on the pelvic floor model, things like that.
I have a question.
Sure, go.
If they were to use the vibration setting, do you think that it could cause an orgasm while you're doing pelvic floor work? Has that ever happened? Has an orgasm ever happened?
So not in clinic with me.
Okay.
But that's why I think that's probably...
Have you ever heard of that?
Default. It wouldn't shock me.
I feel like some people worry about that.
It wouldn't
that
shock
would be embarrassing
me.
to them.
Yeah, so it wouldn't shock me, especially with women who have not experienced certain sensations in their pelvic floor.
Right.
Or increase in awareness in general of the pelvic floor. Like something is touching me here, right? Because it's just like if you took off an oven mitt or a glove after X amount of years of being on this earth, and the first time you take that off, all of this is going to be hypersensitive, right? Very, very sensitive. No different than coming out of a cast in a boot, something like that. We have to desensitize these nerves. The pelvic floor is no different, but a lot of us don't think about that because it's inside of us. So for women, I would say it wouldn't shock me if a patient came back and said, Sarah, I was doing my pelvic floor exercises and I was doing that and I was focusing and I was breathing and I felt X, Y, and Z. This happened. I would say it's okay, right? And so it's not abnormal, and I would just say every woman is different, and I cannot wait to have
added benefit. 2 in 1.
Right. 2, 3, 1. So I cannot wait to have
kill 2 birds with one stone. That's how I look at it.
Yeah,
it hasn't ever happened, but if it did happen, I'd be like, cool.
Yeah, and I would say it's okay to normalize it. It's okay, and I can't wait to have. There's a specialist, a dear friend of mine, who specializes in the different types of orgasms for women. I will not speak on that. We'll hold that, but stay tuned because I think even as a pelvic floor physical therapist, she and I were chatting, and she goes, "Oh no, Sarah, there's so much more." And I was like, "Oh, we'll have to."
There are so many, and I would love to talk to my mom about this too, as somebody who is quadriplegic, because she can still experience that. I found that out, but it's different.
Exactly.
It's different. And I find that super fascinating. The human body just finds a way. Listen, it just finds a way. This is a funny one.
Okay.
This is probably one because I just wanted to laugh. Because people just don't know what the vagina is at all. Can you pee with a tampon in?
Can you pee with the tampon in?
Yeah.
Yes.
How? There's a tampon in.
Different pipes.
Right. Okay.
Different pipes.
Got it. Okay.
Multiple
just for the men
pipelines.
out there that have asked that.
Right. Yeah, you can.
Cool. Got it.
It's a myth that you cannot.
I don't know
unless your pipes are different. So.
I don't know who made that up.
I don't know, but myth busted.
Myth busted.
Right
you
here.
can pee while a tampon's in.
Yes.
Now, do I recommend it? Because the string is going to get wet.
Man. Oh, yeah.
But if you can hold the string... Yeah.
Yeah.
We can
Yeah.
Sex ed. Is that even sex ed?
We'll circle back.
Yeah. You can just pull the string to the side, kind of tight, and then you can do it. But yeah.
Or replace, or Options.
Well, don't you hate it when you just put it in all of a sudden you need to pee again? Especially if pelvic floor is functioning.
Yes.
I just put it in, I'm like, dang it, there's more in there. I didn't get all the way out.
Yeah.
I couldn't get it all the way out. I couldn't get all the urine out of the bladder. So we are at 55 minutes. So that looks like we're about done. We kept it under an hour.
So, great
and
job.
we had so much. How did we do that?
Great job. Great prep.
Good job. Good intro. All right, so that is the intro to pelvic floor. I hope you guys enjoyed. I am looking forward to sharing more with you guys. And I will definitely put down below like any of the links to any things that we talked about, kind of resources you can reach out to, any products. No, we'll leave the products for the doctors maybe.
Right.
And maybe for later.
We can definitely.
But I do have some good products for pelvic ones. That,
absolutely.
Yeah, I found one that's like a bird for entrance pain.
Okay.
Which I don't think is gonna harm anybody if they have a vibrator that's for the. Yeah. Like it just sits right there. It looks like a little bird.
Yeah.
It just sits right there.
Absolutely.
Because if you have pain with the entrance.
Absolutely.
Of penetration.
Different muscles.
The start of the penetration
groups.
that hurts me a lot.
Superficial versus deep pelvic floor. Those are different, and they actually present different in clinic. So I'm really glad you said that.
Yeah, so it's kind of something that you can just like kind of hold in your undies and kind of just sit on and just watch TV, and it just kind of has a low vibration, and just kind of soothing. You just
there's so many different uses.
You can just sit and do what I'm like. That's great. I can just sit and do anything, and nobody has to know, and I can just sit and watch TV, and I don't have to do any active anything.
Yeah.
Just kind of just desensitizes that and hits all the different pressure points. So you can So I think that's a cool one that I think is safe for kind of everyone to use. I think there's no entering anything, which I think is good.
And for any of the viewers that have questions, feel free to comment and question below if there's something that you're interested in, or maybe a myth that has been passed down generation to generation.
Yeah.
We'd love to bust those.
Love to bust those, but we cannot give my medical diagnoses to you over the computer. I'm so sorry. You have to still go see your doctor. So sorry about that.
And we encourage you to.
Yeah, I want you to. I want you to, and I want you to be very clear and concise with your doctors, and don't let them give you any crap, because some things are just not normal. And it just shouldn't be expected of you to live in pain, to live with peeing on yourself, to live in being uncomfortable and embarrassed as a woman.
Mm-hmm. I will say, when you said pee on yourself, last thing we got to jump off. If you experience urination to one side, even if you're not peeing on yourself, if you're constantly urinating to one side, go ahead and check out your inner thighs. Not necessarily stretching them, right? Stretching them extra. But look at the quality of the tissue of your inner thigh. A lot of times that might be weak, overloaded. You might need to stretch it, but always check the quality of that tissue. And I strongly encourage the massage guns for those as well.
Okay, just on the inner thigh.
Yeah, absolutely. Inner thigh.
Cool. All right, well that is it. Thank you for stopping by. I don't know, we don't have a good sign off yet, and it's really awkward. So bye bye.
Bye bye now.
Bye bye now. Bye bye. Bye bye.
Thanks, producer. Shout out
producer Matt in the background who had to listen to us talk about vagina.
Well, sometimes things drop down and they stay down in places where they're not supposed to. That's essentially a prolapse.